Bethany TV for health.
A very good evening to you all, wherever you're watching Bethany TV from. This is Medical Mind. Welcome to the show. And today is a Sunday. As usual, our topic for today is uterine fibroids and fertility. Doctor is already around in the studio. We're going to look at the symptoms, we're going to look at the causes and the possible prevention. Welcome to the show once again. Let's get into the studio. Wherever you're watching us from, please feel free to join us and we discuss the stories. Thank you. Welcome back once again. In case you've just joined us, this is Medical Mind and it's Bethany TV, Teacher Zita, together with our very own specialist, one and only Dr. Andabat, and we're going to look at fibroids today. Many of you have been asking me many questions that I could not answer. I just present. The doctor is always my expert. She's the one who gives me all the answers that comes from you. Doctor, you're welcome to the show.
Thank you.
How was your Sunday?
Oh, lovely. Today was the staff party.
Oh, yes.
Did a lot of games, huh?
Did you play around?
Oh,
Which
yeah,
team were you?
I did. I was more in the cards.
Okay,
I won 2 games.
You won some 2 games.
There was no trophy for me,
Really?
but I'm happy.
That's very good.
Yeah, so it was a very nice moment for me.
Okay.
Yeah, did
Say
you
hello
attend
to our viewer. Oh, yes, I did.
Yes.
As a teacher, you always know, we moderate, we supervise, and we make the games lively. Say hello to the viewers.
Yeah, good evening, viewers, and thank you for tuning in. We hope to have a very good discussion again about fibroids.
Thank you.
Yeah, thank you.
Yes, it's still Medical Mind, and let's go straight because of time, and we look at our illustration on the screen. Our topic today, Doctor, is about uterine fibroids.
Yes.
And I'm sure many mothers are outside that have been waiting for the topic. So here's the day. Let's start off, Doctor. What exactly are fibroids?
Yeah. So it's very important to know what fibroids are. Now, so the simplest definition is that fibroids, these are abnormal swellings within the muscle wall of the uterus. Okay. Yeah, so they arise from the muscles of the womb, and so they grow. And they grow and they are abnormal.
Okay. Is it always one? Can there be more than one in the uterus at a particular time?
Yes, so fibroids, they have variations of characteristics. Some people have 1, others have 2. Majority of them, like over 60% of them, are multiple. So when you find one, there is usually another one around. Okay. So most of them are in multiples. So, but the numbers do vary. Okay. Yes.
Thank you so much, Doctor. How common are they?
Yeah, this condition is very common actually, especially in the reproductive age, between the age of about 25 to around 45. If you look at the statistics, some slight variation, but in our population, we think about 3 to 4 women out of 10 actually do have fibroids. That's in the general population. But again, the incidence goes higher among the people who have infertility. Among the infertility patients, we see about 60% of them. That's 6 out of 10. The good news is that not all of them are problematic. Okay. Yes, so that's why we don't do so much interventions. But those which are causing problems, judged by the doctor, then they need to be treated. But they are very, very common. I think almost every woman knows about fibroids. True.
Yes. Some of us hear about them, but we don't know much about it. We just know it's fibroids, but yes, we don't. So how do you know that this one is problematic and this one is not?
Yes. So fibroids usually problematic is they are those which show you symptoms. Yes, and the commonest symptom we have is bleeding, abnormal bleeding, of course, depending on where the fibroid is located.
That is during periods, menstruation, or?
Oh yes, that's a very good question. Now, the bleeding of fibroid is very, very characteristic. Okay. In most cases, bleeding caused by the fibroid is regular. That is, the bleeding comes when you expect your period. It's actually a period, but it is heavier. It lasts
the normal flow.
Yes, it lasts for a longer time. So if your normal periods usually last for about 3 days, and you find if you have fibroids, you'll be bleeding for more than 5 days, and then there should be something. Or each day, if you are using like 2 pads, this time around, if you have fibroids, you may be using like 5 pads.
Really?
Yes, in some people actually they can have a lot of bleeding and they even become anemic.
That is a serious sign.
Yeah, so that's one of the commonest presentation. Okay. But also, often people feel a mass Because
in
the belly.
In the belly.
Yeah, they feel a mass. So they may feel the mass by themselves, or they see that the belly is increasing in size, or you find that they have symptoms because of the mass effect.
Okay.
For example, it starts pressing on their bladder, so they start passing urine frequently, or they are not able to control their urine very well, or they have issues with stool. So those are the commonest presentations. But also in a few people, we see the fibroid related to miscarriages. Yes. So somebody is having pregnancies, but they keep on coming out. And when you check on a scan, you find the person has a particular type of fibroid, which is pressing in the space where the baby is supposed to be growing. So these are some of the presentations. But of course, some of them are not with symptoms. We need to know. Okay. Yeah, so those which without symptoms usually are not very problematic.
Okay.
Yes.
Thank you. I wanted to ask you a question, but you've answered it already.
It's okay.
Because it's very common for mothers to conceive,
yes,
and then they have miscarriages,
yes,
only to discover that there is a fibroid, yes, growing somewhere.
Yes.
So I was thinking of asking you how this fibroid gets closer and squeezes the baby, or how it makes that
miscarriage, how
yes,
it causes the miscarriage.
It, yes.
So maybe we can look at our illustration on the picture here.
Okay.
Let's look at this. I hope the one with fibroids. Let's see the one with fibroids. I think number 2. Yes, this is the real one. So if you look at number 1, let's have the other image without fibroids.
The first one without fibroids?
Yes, without fibroids. Yes, this one here, yeah, this is the muscle wall of the womb. Okay. Very smooth and regular. Yes. And inside here, what you see as red is the space where the baby grows. Okay. Incidentally, when the baby comes after fertilization, the baby digs through this layer and comes right deep inside here. Now, it gets blood supply through the muscle, blood supply, and then it grows and grows and fills this space. Okay. That's the normal situation. Okay. Now, if you look at when you have fibroids, like what we see in the image 2 here, like a fibroid like this one or this one, these are problematic fibroids, even this in terms of pregnancy. Imagine if the baby comes here and attaches here, and the placenta is supposed to be forming over here. Now, the blood supply here will be, the formation of the placenta will be interfered with because of this fibroid here. And if it goes here, and that's the same thing. Fibroid is parasitic. So
basically, it keeps taking away the space where the baby is supposed to be.
Yeah, it takes away the space. It disturbs the way the placenta is formed, and so the blood supply to the baby will not be good enough. It makes the attachment of placenta very weak, so that the placenta can actually peel off, and you get a miscarriage from that.
Peel off. That's what I wanted to hear. It peels off the placenta.
Exactly. It peels off the placenta. Very good. So such fibroids should not be ignored. We have grades for them, so they shouldn't be ignored.
Doctor, if a mother is expecting and the fibroid is already there,
yes,
what do you do?
Oh yeah, so the logical way of managing that is, the moment the pregnancy is there, and that is the time you diagnose the fibroid, you don't do anything. Even if it is this type, for 2 reasons. Okay. One, if you touch a fibroid during pregnancy, chances are over 80% that pregnancy will come out. Okay. Second reason is the blood supply during pregnancy usually increases. And so if you want to touch the fibroids, the woman can, in most cases, bleed to death. And that is very dangerous. And the third and very, very important reason, which we always say, is diseases don't read books. Diseases don't read books because what you judge by your thinking and from your knowledge, that if the placenta is around here and maybe the fibroid is close, that it may lead to miscarriage. You will be shocked to find out that actually this pregnancy goes up to term and they deliver. So diseases don't read books. Once the pregnancy is in, give it chance.